Medical coding is a critical profession in healthcare and requires specific credentials to validate a coder's expertise. Not all certifications are the same. In this video, we explore the different AAPC medical coding certifications and what makes each one unique. Certified Professional Coder, CPC. The CPC credential validates expertise in reviewing medical records to abstract accurate coding information, identify documentation deficiencies, and properly query providers. CPCs demonstrate proficiency in assigning CPT, HCPCS Level 2, and ICD-10-CM codes with a strong foundation in anatomy, physiology, and medical terminology. They code across multiple service areas, including EM, anesthesia, surgery, radiology, pathology, and medicine, and understand compliance, reimbursement, medical necessity, bundling, denials, charge capture, and payment policy changes. The CPC exam tests knowledge of CPT, HCPCS Level 2, and ICD-10-CM coding for physician services. It focuses on evaluation and management, anesthesia, surgery, radiology, pathology, and medicine, along with anatomy, medical terminology, modifiers, compliance, NCCI edits, medical necessity, and reimbursement guidelines. Certified Inpatient Coder, CIC. The CIC credential is exclusively focused on inpatient hospital coding. CICs specialize in ICD-10-CM and ICD-10-PCS coding and demonstrate mastery of MS-DRGs and the Inpatient Prospective Payment System. Inpatient coding centers on facility services rather than physician services. CIC certified professionals typically work in acute care hospitals, skilled nursing facilities, critical access hospitals, inpatient rehab facilities, teaching hospitals, and long-term care hospitals. The CIC exam tests inpatient hospital coding using ICD-10-CM and ICD-10-PCS. It emphasizes medical record abstraction, MS-DRG assignment, inpatient guidelines, Medicare, inpatient prospective payment system rules, compliance, and facility-based coding principles. Certified Outpatient Coder, COC. The COC credential focuses on outpatient facility coding. COC certified coders report services in settings such as hospital outpatient clinics, emergency departments, therapy departments, cancer centers, dialysis units, outpatient radiology departments, and ambulatory surgery centers. The COC exam tests outpatient facility coding using CPT, HCPCS Level 2, and ICD-10-CM. It covers hospital outpatient services, emergency department coding, outpatient procedures, APC methodology, modifiers, reimbursement rules, and compliance guidelines. Certified Risk Adjustment Coder, CRC. The CRC demonstrates expertise in chronic conditions, comorbidities, ICD-10-CM guidelines, and risk adjustment models. They ensure documentation accurately reflects patient health status and that all clinically documented diagnoses are properly reported. The CRC exam tests ICD-10-CM diagnosis coding with a strong emphasis on chronic conditions, comorbidities, HCCs, meet criteria, and risk adjustment models. It focuses on documentation accuracy, disease specificity, and risk adjustment compliance. Certified Professional Medical Auditor, CPMA. CPMAs are in high demand due to increased regulatory scrutiny. They identify compliance risks, help prevent fraud and abuse, and ensure accurate reimbursement. CPMA certification validates expertise in medical record auditing, documentation standards, statistical sampling, quality assurance, coding risk analysis, fraud regulations, and communication of audit findings. The CPMA exam tests medical auditing principles, including documentation standards, compliance regulations, fraud and abuse laws, statistical sampling, audit methodologies, risk analysis, and communication of audit findings. Certified Professional Practice Manager, CPPM. The CPPM credential is designed for experienced healthcare professionals ready to advance into physician practice management roles. The CPPM exam tests Physician practice management topics such as revenue cycle management, compliance, human resources, healthcare regulations, budgeting, risk management, and operational workflows. Certified Professional Compliance Officer, CPCO. The CPCO certification demonstrates knowledge of developing, implementing, and monitoring healthcare compliance programs. It includes expertise in audits, risk assessments, internal reviews, staff training, and regulatory compliance. The CPCO exam tests knowledge of healthcare compliance programs, including regulatory requirements, audits, risk assessments, internal monitoring, staff education, and enforcement of governmental compliance standards. Certified Documentation Expert Outpatient, CDEO. The CDEO credential validates expertise in reviewing outpatient documentation to support accurate coding, quality measures, and clinical requirements. CDEOs provide feedback to improve provider documentation and ongoing compliance. The CDEO exam tests outpatient clinical documentation improvement concepts, focusing on documentation accuracy, coding support, quality measures, provider education, and regulatory documentation requirements. Certified Documentation Expert Inpatient CDEI. The CDEI certification focuses on inpatient documentation accuracy to support coding and reimbursement. It requires knowledge of pathophysiology, inpatient coding guidelines, and healthcare payment models, with an emphasis on provider education and documentation improvement. The CDEI exam tests inpatient documentation improvement, including pathophysiology, inpatient coding guidelines, DRGs, clinical indicators, query compliance, and healthcare payment models. Certified Evaluation and Management Coder, CEMC. The CEMC certification validates advanced EM coding expertise, including MDM and time-based coding. It covers ICD-10-CM, CPT, HCPCS Level 2, modifiers, Medicare rules, NCCI edits, global surgery, risk assessment, and identification of missed billing opportunities across multiple specialties. The CEMC exam tests advanced EM coding, including medical decision-making, time-based coding, ICD-10-CM, CPT, modifiers, Medicare rules, NCCI edits, risk assessment, and identification of compliance and revenue issues. Certified Ambulatory Surgery Center Coder, CASCC. The CASCC certification demonstrates expertise in ASC coding and reimbursement rules, including multiple, device-intensive, and discontinued procedures. It includes operative report analysis, ancillary coding, regulatory compliance, anatomy, and medical terminology. The CASCC exam tests ASC-specific coding and reimbursement rules, including operative report analysis, CPT, HCPCS Level 2, modifiers, multiple and discontinued procedures, device-intensive procedures, and regulatory compliance. Certified Anesthesia and Pain Management Coder, CANPC. The CANPC certification validates proficiency in anesthesia and pain management coding, including time units, modifiers, anesthesia guidelines, surgical crosswalking, EM integration, Medicare rules, and NCCI policies. The KNPC exam tests anesthesia and pain management coding, including anesthesia CPT codes, modifiers, time units, crosswalking surgical procedures, Medicare rules, NCCI policies, and EM concepts related to anesthesia services. Certified Cardiology Coder, CCC. The CCC certification demonstrates expertise in cardiology coding, including cardiac catheterization, coronary interventions, pacemakers, peripheral vascular procedures, and EM services, along with Medicare rules and modifier use. The CCC exam tests cardiology coding, including ICD-10-CM, CPT, HCPCS Level 2, and modifiers for cardiac procedures such as catheterizations, coronary interventions, pacemakers, peripheral vascular procedures, and cardiology EM services. Certified Cardiovascular and Thoracic Surgery Coder, CCVTC. The CCVTC certification recognizes advanced expertise in cardiovascular and thoracic surgical coding, including cardiopulmonary bypass, PTCA, lung tumor ablation, and complex operative reporting. The CCVTC exam tests advanced surgical coding for cardiovascular and thoracic procedures, including operative node analysis, CPT, ICD-10-CM, modifiers, Medicare rules, and complex surgical reporting. Certified Emergency Department Coder, CEDC. The CEDC certification validates proficiency in ED coding, including EM services, procedures such as laceration repair, fracture care, moderate sedation, foreign body removal, and compliance with Medicare and NCCI guidelines. The CEDC exam tests emergency department coding, including ED/EM services, procedures, moderate sedation, time-based coding, ICD-10-CM, CPT, HCPCS Level 2, modifiers, and Medicare compliance rules. Certified Family Practice Coder, CFPC. The CFPC certification recognizes expertise in family medicine coding, including EM services, injections, EKGs, minor surgical procedures, time-based coding, and proper sequencing. The CFPC exam tests family medicine coding, including EM services, minor procedures, injections, EKGs, ICD-10-CM, CPT, HCPCS Level 2, modifiers, sequencing, time-based coding, and Medicare rules. Certified Gastroenterology Coder, CGIC. The CGIC certification demonstrates expertise in coding GI procedures, such as colonoscopies, ERCP, endoscopy, hernia repairs, and related surgical services, along with EM and Medicare compliance. The CGIC exam tests gastroenterology coding, including endoscopic procedures, colonoscopies, ERCPs, operative reporting, EM services, modifiers, ICD-10-CM, CPT, HCPCS Level 2, and compliance guidelines. Certified General Surgery Coder, CGSC. The CGSC certification validates advanced skill in general surgery coding, including hernia repairs, breast procedures, transplants, skin grafts, cholecystectomy, pancreatic resections, and operative report analysis. The CGSC exam tests general surgery coding, focusing on operative node analysis, CPT, ICD-10-CM, modifiers, global surgery rules, EM services, and complex surgical procedures. Certified Hematology and Oncology Coder, CHONC. The CHONC certification demonstrates proficiency in coding oncology and hematology services, including chemotherapy administration, hydration, injections, bone marrow procedures, and related EM services. The CONC exam tests coding for hematology and oncology services, including chemotherapy and infusion coding, injections, hydration, bone marrow procedures, ICD-10-CM, CPT, HCPCS Level 2, modifiers, and EM services. Certified Interventional Radiology Cardiovascular Coder, CIRCC. The CIRCC certification validates advanced expertise in cardiovascular interventional radiology coding, including angiography, vascular interventions, cardiac catheterization, and coronary procedures. The CIRCC exam tests cardiovascular interventional radiology coding, including angiography, vascular interventions, cardiac catheterization, CPT, and HCPCS Level 2 coding, modifiers, anatomy, and procedural hierarchy. Certified Obstetrics and Gynecology Coder, COBGC. The COBGC certification demonstrates proficiency in obstetric and gynecologic coding, including antepartum care, deliveries, postpartum care, hysterectomies, biopsies, and colpopexies. The COBGC exam tests obstetric and gynecologic coding, including antepartum, delivery, postpartum care, surgical procedures, EM services, ICD-10-CM, CPT, modifiers, and Medicare compliance rules. Ophthalmology Coder, COPC. The COPC certification recognizes expertise in ophthalmology coding, including cataract surgery, glaucoma procedures, retinal repairs, vitrectomy, corneal transplants, and EM services. The COPC exam tests ophthalmology coding, including eye-specific procedures, surgeries, diagnostics, ICD-10-CM, CPT, HCPCS Level 2, modifiers, EM services, and Medicare ophthalmology rules. Certified Professional Biller CPB. The CPB credential focuses on medical billing, including claims submission, reimbursement processes, and billing compliance regulations. The CPB exam tests medical billing processes, including claims submission, payer rules, reimbursement methodologies, denial management, compliance, and revenue cycle fundamentals. The Certified Professional Coder in Dermatology, CPCD. ICD-10-CM coding for dermatologic conditions such as acne, eczema, psoriasis, skin infections, and skin cancers. EM service selection for dermatology visits, including preventive, diagnostic, and procedural encounters, proper use of modifiers, NCCI edits, and payer rules specific to dermatology. The CPCD exam tests biopsies, excisions, and lesion services, dermatologic surgical and repair procedures, cosmetic, therapeutic, and specialty services. The Certified Pediatrics Coder, CPEDC. Core knowledge areas, well-child visits and preventive medicine coding, pediatric EM services for acute, chronic, urgent, and hospital care. Accurate ICD-10-CM diagnosis coding for neonatal, infant, and child conditions. Application of pediatric-specific modifiers and payer compliance guidelines. The CPEDC exam tests, immunizations and preventive services, pediatric specialty and procedural care, behavioral and developmental health. The Certified Rheumatology Coder, CRHC. Core knowledge areas, ICD-10-CM diagnosis coding for autoimmune, connective tissue, and musculoskeletal conditions such as rheumatoid arthritis, lupus, scleroderma, vasculitis, and gout. EM service selection for new, established, and consultative rheumatology patients. Proper application of modifiers and compliance with payer-specific guidelines. The CRHC exam tests, infusion and injection services, diagnostic and therapeutic procedures, chronic disease management. The Certified Urology Coder, CUC. Core knowledge areas, ICD-10-CM diagnosis coding for common and complex urologic conditions, EM coding for outpatient, inpatient, and consultative urology services, appropriate use of modifiers and payer guidelines to ensure compliant billing and reimbursement. The CUC exam tests, surgical and procedural coding, diagnostic and therapeutic services, pediatric and specialty urology. We hope this clarifies AAPC certifications.